So I'm Heather Burney, and I am a family physician. During the COVID pandemic, I think when it first started, the biggest difference was really how we had to see and treat patients. Particularly when it comes to COVID, because the symptoms are so similar to other conditions, it was hard to kind of figure out, okay, is this something other viral syndrome? Is this something else? Or is this COVID? It changed our life because of the deadly impact that it had. And so not only were you worried about your patients, but you were also worried about your family members.
My name is Teddy Andrews, and I am a flight attendant for a major airline here in the United States. Back in March of 2020, after traveling out of the country to do some training for the company, the border was about to be shut down for Europe, and so I went back to the United States, came back home, and had the sniffles, simply. Just the sniffles. Got worse over the weekend. Decided I was going to get some cough medicine, some over-the-counter medicine, some orange juice, and just kind of stay home and relax a little bit, right? But the next thing you know, over the entire weekend, I'm getting worse and worse. Symptoms are getting worse. High fever, aches, pains, chills, sweats, night sweats, clothes soaking wet. The entire weekend. So I decided I'm going to go to urgent care on Monday morning. So I go to urgent care on Monday morning. They said, let's test you for the flu. You've been out of the country, you're a flight attendant, let's test you for the flu. They test me for influenza A and B. 15 minutes later, negative test. Okay, Mr. Andrews, what we're going to have to do is test you for COVID. The next day, Tuesday, Health and Human Services calls me and says, listen, you've tested positive for COVID and you're now on 14-day quarantine. This was also what was going on at that time, is they gave you a letter that said you have to stay in 14 days if you're found outside of your home, $2,000 fine or 2 years imprisonment if you're caught out of your house. So I was quarantined for the next 14 days. That was on that Tuesday when I got the call. By Thursday, I couldn't breathe. Body aches, chills, fevers the entire time. Took my temperature. My temperature at that time was 104. Couldn't breathe. That Thursday morning I got up, I couldn't catch my breath. I called the ambulance. I was rushed to Atrium Health Hospital and was admitted with a 104.5 fever and oxygen levels at 88%.
And one of the things that people ask me all the time, well, is this like the flu? It's not the flu, okay? We typically lose about 30,000 people each year from the flu. So the magnitude of how COVID is killing people, when we're talking about over 650,000 lives lost, and that's just in America. That's not even across the world, but we typically lose about 30,000 people to the flu.
I was now being transported to the ICU unit at Atrium Health. My family was called, my daughters, my sisters, my brothers, saying if he makes it to the morning, it'll be a miracle. I was scared, man. I thought I was going to die. I literally thought I was going to die. Each breath was my last breath. Literally, like I couldn't get words out. Every breath was just like a major challenge just to breathe.
50% of people, once they recovered from COVID, up to 6 months after they've recovered from COVID, people still have symptoms. For up to 6 months. Half of the people, I have patients that were not on oxygen, that have overwhelming fatigue, that have not been able to come off oxygen after COVID. People with normal lungs, young people are dying. I'm terrified for the decisions that people are making for these children that are not even able to get the vaccine yet. We haven't done the studies to be able to authorize it for children.
When I first came home, I could barely walk from my house, the front door to my mailbox, which is just a driveway away. I could barely walk. I became a borderline diabetic. Had never had any problems with diabetes, although diabetes runs in my family, so it could be hereditary, but it never came to light prior to me having COVID. And the other thing was headaches. I have severe headaches in the back of my head now that have been since the COVID onset until now, that I'm now taking just some over-the-counter ibuprofen for on a regular basis because they can be very severe at times.
I think that we have to acknowledge, particularly in the communities of color, particularly African Americans, there's a lot of mistrust of the medical community. And so I think you have to acknowledge that. You have to say, look, in the past, there have been times where the medical community has failed us and has done things that have taken advantage of communities of color. I don't think that this is what's happening now. And so I do believe that, unfortunately, we don't really understand why communities of color have been more adversely affected by this pandemic and by this infection. People talk to me about, the chip, and so are they implanting a chip in my body? Well, guess what? They don't need a vaccine to implant a chip. They have the biggest chip that you carry with you at all times, i.e. your cell phone. For a lot of these people, particularly patients that I'm seeing, I'm their doctor. I've been your doctor. I've been practicing for 20 years. A lot of these people, I've been your doctor for 20 years. You've trusted my medical advice in every other situation. Maybe you did your own independent research, but unfortunately, research today, depending on what you research, it's gonna lead you down a path. Are you getting good information? Do I think that Facebook or social media in general, really, not to vilify Facebook, Twitter, Instagram, TikTok, whatever, that's your source of medical information? That's the source that you trust? So you trust social media more than you trust your doctor? Come on. Come on.
When I heard the vaccine was coming, I said, sign me up for the Christian Jubilee. I was like, sign me up. Where do I sign up? Put my name on the dotted line. When? Tell me when, what day, where do I have to go? And I immediately began to go online and search to see where I could go and where were appointments. And thankfully, because I am a flight attendant or a part of the flight attendant industry or the aviation industry, they were making exceptions for us to actually get in a little early because we were working with the general public to get shots. And so I signed up and got my first dose, and there was no question about it. I knew if this was something that was going to actually prevent what I went through, I was going to get it.
Now that we're, 6 to 8 months into, 8 months into this emergency use authorization, really the vaccine's been pretty good. It's really been a lifesaver for sure for a lot of people and a lot of families, and it's changed, the perspective of what COVID can do to you. Because that's one of the things that I always want to make sure patients understand or people understand, that the vaccine prevents severe disease. So you can still get COVID if you got vaccinated, but you'll have a milder case that hopefully you will not end up in the hospital, not end up in the intensive care unit, and not succumb to the complications of the disease.
So those that are hesitant, those that are just a little leery about it, there's no judgment zone here from me. I don't judge you. There's no judgment. I don't think that you're crazy or irrational for not getting it. I just question whether or not you have the knowledge that you need, that you've talked to the right people. Talk to your primary care physician. Talk to your trusted family members or friends and get their take on it. And then talk to your doctor and see what your doctor is saying as it relates to your health conditions. Because there are some people who won't take it because of their health condition. They have underlying issues that may interact with what the vaccine might do to them. So talk to your primary care physician. But there's a lot of us, especially in the African American community, that we're still listening to the stuff that we knew from back in the 30s and the 40s, or like that Tuskegee experiment. And oh, I don't trust it, or I'm still waiting to see. We're a year into the vaccines, and the vaccines have been proven to be 95 to 98% effective. These are effective. So we're not living back in the 50s and when that stuff happened. No judgment again. I get that you have a concern there, but there's been such improvement in medication And medication and prayer works together. So we don't want to wait until we get to the point that we're so sick that now we want the saints to pray us down, fire and brimstone from heaven to get us through this situation when we have preventative care. You know, my grandmother used to say to me all the time, God doesn't work miracles in the place of common sense.
Be patient. That really would be the first thing. That I don't think we need to rush back to our new normal, because I hear people saying all the time that I want to get back to normal. It's going to be our new normal. COVID is not going away. So I would say be patient. Don't rush back to the activities you used to have. I think you need to be patient and wait and see what these numbers are showing. I think that you have to be cautious and you need to be careful. You need to be careful about the decisions that you make to expose yourself to people without your mask. You need to be cautious and make sure that those are controlled environments. I absolutely believe you should get your vaccine. I do believe that it is the safest tool we have right now to prevent severe disease and prevent death. So I absolutely believe that we should get vaccinated. I do believe that we should be wearing masks as well, even if you are vaccinated at this point, because we're just not sure about the activity of this virus as it continues to mutate. The Delta variant is scary, more contagious, more deadly than the original that we were dealing with this time last year. And the virus continues to mutate. We have now, maybe you've not heard about it, the Lambda virus is here. It's in the United States. I have not heard about any cases in North Carolina yet, but it's coming. And we don't know how this virus is going to act and continue to act. And the tool that we have right now that has been the most effective at preventing death is the vaccine. Period, point blank.